8 medications that damage memory and the brain. Did you know that some common medications can harm your memory and brain health? Have you ever wondered if the medication you are taking might be contributing to cognitive decline? What if you could identify and avoid these medications, improving your quality of life? Recent research shows that memory loss is not inevitable with aging. Certain medications, used without proper guidance, can have significant adverse effects on the brain. Why do seemingly harmless drugs cause such severe damage? And how can we protect our brains while treating other health conditions? Studies indicate that proton pump inhibitors, like omeprazole and anticholinergics, used to treat conditions like Parkinson's, increase the risk of dementia. Are we really aware of the risks? Self-medication can exacerbate these effects. Stay with us until the end, because medication number 7 is the most dangerous, and almost no one knows about it. Important. We have listed all the references used to create this video in the description for you to access whenever you want. Let's get started. Aging and dementia. What do we really know? For a long time, it was believed that dementia and cognitive decline were inevitable consequences of aging. However, recent research has challenged this perspective, suggesting that memory loss is not a normal and inevitable part of aging. Dementia, including Alzheimer's disease, results from specific pathological processes that affect the brain, not simply advanced age. Studies show that it is possible to keep cognition sharp and even improve certain skills over the years, as long as risk factors are properly managed. Various elements can contribute to brain health in old age, including a balanced diet, regular exercise, mental and social stimulation, and the management of chronic conditions like hypertension and diabetes. However, there are lesser-known factors that can precipitate or aggravate cognitive decline. Alcohol abuse, smoking, brain injuries, strokes, chronic insomnia, and persistent stress are widely recognized as negative influencers on brain health. Additionally, nutritional deficiencies, especially vitamin B12, and psychiatric disorders also play critical roles. Understanding the processes underlying dementia has advanced significantly, highlighting the importance of tau and beta-amyloid proteins in forming tangles and plaques that damage brain cells. Moreover, genetic factors can predispose certain individuals to develop dementia, although environment and lifestyle can significantly modify these risks. Preventing dementia involves a multifaceted approach, including promoting a healthy lifestyle, controlling chronic diseases, and medical interventions when necessary. Research continues to explore new therapies and interventions that may slow or prevent the progression of dementia. Recognizing that cognitive decline is not an inevitable part of aging can inspire changes that promote brain health throughout life. Surprising factors that contribute to memory loss. Memory loss is a complex and multifaceted phenomenon that can result from a variety of factors. In addition to well-known factors like aging and neurodegenerative diseases, there are other less obvious but equally impactful ones. Substance abuse, such as alcohol and tobacco for example, is a significant factor. Alcohol in particular can cause direct brain damage, while tobacco contributes to vascular problems that affect brain health. Traumatic brain injuries, resulting from accidents or contact sports, are also a common cause of memory loss. These injuries can cause immediate damage, or lead to long-term cognitive problems, such as chronic traumatic encephalopathy. Strokes are another significant cause, interrupting blood flow to the brain and resulting in damage that affects memory and other cognitive functions. Insomnia and sleep disorders have a direct relationship with mental and cognitive health. Chronic sleep deprivation interferes with memory consolidation processes, making it harder to retain new information and retrieve existing memories. Chronic stress is also harmful, as cortisol, the stress hormone, can damage brain structures involved in memory, such as the hippocampus. Nutritional deficiencies, especially vitamin B12, are another less recognized cause of memory loss. Vitamin B12 is essential for neuronal health, and its deficiency can lead to significant neurological symptoms, including memory loss and mental confusion. Psychiatric disorders such as depression and anxiety also affect memory. Depression, for example, can lead to decreased concentration and recall capacity, while chronic anxiety can interfere with the brain's ability to process and store information. In summary, memory loss can be influenced by a combination of factors, many of which can be prevented or managed. Awareness and proper management of these factors can help preserve cognitive function throughout life. Common medications that can damage your memory. Many regularly used medications can have adverse effects on memory and cognitive function, a fact that is often unknown to patients. These medications, while effective for treating various health conditions, can have significant side effects that include the deterioration of memory and other cognitive functions. Below, we explore how some common medications can negatively impact the brain. 8 medications that damage memory and the brain. 1. Omeprazole and its hidden dangers to the brain. Widely used to treat conditions like heartburn, omeprazole belongs to the class of proton pump inhibitors, PPIs, which also include lansoprazole, pantoprazole, esomeprazole, among others. These medications are effective in reducing gastric acid secretion, providing relief from symptoms of reflux and gastritis. However, prolonged use has been associated with serious risks to brain health. Epidemiological studies indicate that continuous use of PPIs is linked to an increased risk of dementia and memory loss. A study involving about 6,000 people showed that 10% of participants who took omeprazole for more than 3 years suffered memory loss. Another study found that 33% of patients who used the drug for more than 4.5 years reported cognitive disorders. The connection between PPIs and cognitive problems may be related to decreased absorption of vitamin B12, a crucial nutrient for neurological health. B12 deficiency can lead to neurological and cognitive disorders. Additionally, PPIs can alter gut microbiota, which can negatively impact brain function. The indiscriminate use of omeprazole is common due to its availability without a prescription. However, it is crucial that patients consult their doctors before starting a prolonged treatment with PPIs. Accurate diagnosis of conditions like gastritis or ulcers should precede the prescription of these medications. Generally, PPI treatment should be limited to periods of 2 weeks to 3 months, depending on the medical condition and necessary dietary adjustments. Besides cognitive risks, prolonged use of omeprazole is also associated with other health problems, such as vitamin deficiencies, kidney diseases, bone fractures, and an increased risk of respiratory and intestinal infections. Therefore, it is vital to use these medications cautiously and under strict medical supervision to avoid long-term complications. 2. Anticholinergics, the dark side of popular medications. Anticholinergics are widely used to treat a variety of conditions, including Parkinson's disease, overactive bladder, and certain respiratory disorders. They work by blocking the action of acetylcholine, a crucial neurotransmitter for many bodily functions, including memory and learning. Although effective, these medications can have significant adverse effects on the brain, especially with prolonged use. Studies show that anticholinergics are associated with a significant increase in the risk of dementia and other cognitive disorders. Research conducted by the University of Washington, which followed more than 3,500 elderly people for 10 years, found that those who used anticholinergics regularly had a 54% higher risk of developing dementia. This risk increased with the dose and duration of use. The most common anticholinergics associated with cognitive decline include scopolamine, mecamylamine, atropine, piperidine, oxybutynin, trihexyphenidyl, and dicyclamine. These medications, by blocking acetylcholine, interfere with neuron communication, impairing memory and learning processes. On the other hand, anticholinergics such as glycopyrrolate, trospium, tolterodine, darafenacin, fesoterodine, tiotropium, and ipratropium, especially when administered by inhalation, were not associated with these adverse cognitive effects. The indiscriminate use of these medications, especially among the elderly, is concerning due to their potential contribution to cognitive decline. It is crucial that patients and doctors carefully consider the risks and benefits of anticholinergics, seeking alternatives when possible and limiting use to the minimum necessary doses and durations. Besides cognitive risks, anticholinergics can cause other side effects, such as dry mouth, constipation, urinary retention, and blurred vision. Therefore, awareness of the risks associated with these medications is vital for preserving cognitive health and quality of life. especially in vulnerable populations like the elderly. 3. Corticosteroids. When treatment affects your brain. Corticosteroids are powerful medications used to treat a wide range of conditions, from asthma and allergies to autoimmune and inflammatory diseases. However, prolonged use of corticosteroids, especially when administered orally, is associated with several serious adverse effects, including deterioration of mental and cognitive health. Studies have shown that corticosteroids can cause structural changes in the brain, leading to problems such as disorientation, confusion, depression, and anxiety. An epidemiological study in the UK, which analysed data from over 500,000 people, revealed that those who used corticosteroids for asthma for long periods had a significantly higher risk of developing dementia and other mental health disorders. Glucocorticoids, such as prednisone and dexamethasone, are particularly concerning when used long-term. They can interfere with brain function, possibly due to changes in cortisol levels, a stress hormone that, in excess, can damage neurons in the hippocampus, the region of the brain responsible for memory. Even inhaled corticosteroids, such as fluticasone, budesonide, and mometasone, although considered safer, can have negative impacts when used in high doses or for prolonged periods. Besides cognitive risks, prolonged use of corticosteroids is associated with other adverse effects, such as osteoporosis, diabetes, hypertension, and increased susceptibility to infections. To minimize these risks, it is crucial that the use of corticosteroids is carefully monitored by healthcare professionals. Patients should be informed about potential adverse effects and encouraged to use the lowest effective dose for the shortest possible time. Non-pharmacological management strategies and therapeutic alternatives should be considered whenever possible to reduce dependence on corticosteroids. Awareness of the impacts of corticosteroids on mental and cognitive health can help promote safer and more informed use of these medications, protecting patients from long-term complications. 4. Benzodiazepines, the silent risk to memory. Benzodiazepines are a class of medications widely prescribed to treat anxiety and insomnia. Known for their calming and relaxing effects, these drugs, such as alprazolam, diazepam, and lorazepam, are effective in quickly relieving anxiety symptoms. However, their prolonged use can have severe consequences for brain health. Studies have demonstrated a clear association between prolonged use of benzodiazepines and memory loss. Research suggests that these medications can double the risk of developing Alzheimer's, possibly due to permanent brain damage. One study indicated that more than 40% of benzodiazepine users experienced a variety of neurological symptoms, including difficulty concentrating, lack of energy, nervousness, and increased sensitivity to sensory stimuli. Besides memory loss, prolonged use of benzodiazepines is associated with a range of other adverse effects. These include sleep problems, anxiety, myalgia, and muscle weakness. Physical and emotional dependence is also a significant risk, making it challenging for many patients to stop using these medications. The relationship between benzodiazepines and Alzheimer's is particularly concerning. The exact mechanism is not fully understood, but it is believed that these medications may interfere with the normal function of neurotransmitters, leading to structural and functional changes in the brain. Additionally, prolonged use can negatively affect the sleep cycle, crucial for memory consolidation. Given the severity of these risks, it is essential that benzodiazepine use is carefully monitored and limited. Doctors should consider non-pharmacological alternatives for treating anxiety and insomnia, such as cognitive behavioral therapy, relaxation techniques, and lifestyle adjustments. When benzodiazepine use is necessary, it should be for short periods and at the lowest effective doses. Awareness of the risks associated with prolonged benzodiazepine use is crucial for protecting patients' brain health and promoting safer and more effective management of anxiety and insomnia. 5. Amphetamines and the memory trap. Amphetamines, including the popular Adderall, are widely used in the treatment of attention deficit hyperactivity disorder, ADHD. These medications are known for their ability to improve concentration and reduce hyperactivity in the short term. However, prolonged use of amphetamines can have significant adverse effects, including memory loss. Amphetamines work by increasing levels of neurotransmitters such as dopamine and norepinephrine in the brain, which temporarily enhances concentration and focus. However, continuous use can lead to a series of problems such as physical and emotional dependence, sleep difficulties, irritability, and even depression. Memory loss is one of the most concerning side effects associated with prolonged use of these drugs. Studies show that high and prolonged doses of amphetamines can cause permanent brain damage. Besides memory problems, long-term users may experience decreased motivation and overall cognitive performance. These effects can persist even after stopping the medication, indicating lasting damage. Another significant risk of amphetamines is the potential for abuse and addiction. Due to their stimulating effects, these drugs can be misused, leading to serious complications such as cardiac arrhythmias, digestive problems, and even sudden death. Psychological dependence can also be a significant challenge, making it difficult to stop using the medication, even when adverse effects become evident. To minimize the risks associated with amphetamines, it is essential that these medications are prescribed and monitored by healthcare professionals. Patients should be informed about potential adverse effects and encouraged to strictly follow recommended doses. Therapeutic alternatives and non-pharmacological approaches, such as behavioral therapy and stress management techniques, should be considered for ADHD treatment. Awareness of the risks of amphetamines is crucial for promoting safer and more effective use of these medications, protecting patients' brain health in the long term. 6. First generation. Antihistamines. Relief today, problems tomorrow. First-generation antihistamines, such as chlorpheniramine and diphenhydramine, are widely used to relieve allergy and cold symptoms. While effective in immediately alleviating symptoms like congestion and itching, these medications have a dark side: their long-term adverse effects on memory and cognitive function. These antihistamines work by blocking the action of histamine, a substance in the body that causes allergy symptoms. However, they also have an anticholinergic effect, meaning they block acetylcholine, a crucial neurotransmitter for memory and learning. Prolonged use of these medications can therefore lead to significant cognitive problems. Studies have shown that first-generation antihistamines are associated with an increased risk of dementia. Recent research reviewed 138 studies on the adverse effects of these medications and found a strong association between prolonged use and cognitive disorders. Patients who used these medications regularly reported memory problems and difficulty concentrating, even after stopping use. Safer alternatives, such as second-generation antihistamines, for example loratadine and cetirizine, have fewer adverse effects and are not associated with cognitive problems. These medications are preferred for long-term allergy treatment, offering effective symptom relief without the same risks to brain health. Besides cognitive risks, first-generation antihistamines can cause other side effects, such as drowsiness, dry mouth, and blurred vision. These effects can significantly impact quality of life, especially in the elderly, who are more susceptible to adverse effects of these medications. To minimize risks, it is important that patients consult their doctors before using first-generation antihistamines for long periods. Considering safer alternatives and adopting other allergy management measures, such as environmental and dietary changes, can help reduce the need for these medications and protect cognitive health. 7. Tricyclic antidepressants, the connection to memory loss. Tricyclic antidepressants, such as amitriptyline and nortriptyline, were some of the first medications developed to treat depression. While effective in relieving depressive symptoms, these medications have a side effect profile that includes memory loss and other cognitive problems. These antidepressants work by blocking the reuptake of neurotransmitters like serotonin and norepinephrine, increasing their availability in the brain. However, they also have strong anticholinergic properties, meaning they block acetylcholine, a neurotransmitter vital for memory and learning. Prolonged use of tricyclic antidepressants has been associated with an increased risk of dementia and other cognitive disorders. Studies show that patients who use tricyclic antidepressants regularly experience a faster decline in cognitive function compared to those who do not use them. These medications can cause concentration difficulties, confusion, and short and long-term memory loss. Additionally, The risk of adverse effects is particularly high in the elderly, who are more sensitive to the anticholinergic properties of these medications. Today, there are safer alternatives such as selective serotonin reuptake inhibitors, SSRIs, which have fewer side effects and are not associated with memory problems. Examples include fluoxetine and sertraline, which are widely used to treat depression and anxiety with a better safety profile. Besides memory effects, tricyclic antidepressants can cause other adverse effects such as dry mouth, constipation, blurred vision, and weight gain. These effects can negatively impact patients' quality of life and, in some cases, lead to treatment discontinuation. To minimize risks, it is essential that doctors and patients carefully discuss treatment options for depression, considering the benefits and potential adverse effects. The use of tricyclic antidepressants should be closely monitored, especially in vulnerable populations, and safer alternatives should be considered whenever possible. 8. Statins. The paradox of cholesterol and cognitive function. Statins, such as atorvastatin and simvastatin, are widely prescribed to lower cholesterol levels and prevent cardiovascular diseases. While effective in protecting against heart attacks and strokes, there is a growing body of evidence suggesting that prolonged use of statins can have adverse effects on cognitive function. Studies indicate that some people who take statins experience memory problems and mental confusion. Although these side effects are not common, they can be significant for those who experience them. It is believed that statins may interfere with cholesterol production in the brain, which is essential for synapse formation and cognitive function. A review of observational studies and clinical trials showed mixed results about the relationship between statins and cognitive function. Some studies suggest that statins may protect against dementia, while others indicate an increased risk of memory problems. This discrepancy may be due to differences in studied populations, statin doses, and treatment duration. Besides potential memory effects, statins can cause other side effects, such as muscle pain, weakness, and digestive problems. These effects can impact patients' quality of life and, in some cases, lead to treatment discontinuation. To minimize risks, it is crucial that patients and doctors discuss the potential adverse effects of statins and closely monitor any cognitive symptoms that may arise. In some cases, adjusting the dose or switching to a different statin can help alleviate side effects. Additionally, patients should be encouraged to adopt a healthy lifestyle, including diet and exercise, to help control cholesterol levels and reduce dependence on medication. Awareness of the potential adverse effects of statins is essential for making informed treatment decisions and protecting patients' cognitive health. Self-medication and prolonged use of certain medications can have significant adverse effects on memory and cognitive function. This article highlighted how common medications, including omeprazole, anticholinergics, corticosteroids, benzodiazepines, amphetamines, first-generation antihistamines, tricyclic antidepressants, and statins, can harm the brain in the long term. It is crucial that patients always consult their doctors before starting or continuing any medication. Informed discussions about risks and benefits, as well as exploring safer alternatives, are essential for protecting cognitive and overall health. Thank you for watching. Don't forget to subscribe to the channel. I wish you great health, wealth, and happiness. See you in the next video. See you in the next video. See you in the next video. See